I had numerous people in my life that imprinted a sense of how great medicine was on me at an early age. And some of my uncles were both physicians and orthopedic surgeons. I also had time to spend with some of my friends' parents in Hyde Park growing up that were actually orthopedic surgeons that helped train me later in my career. At an early age, I sort of had a knack for taking things apart and putting them back together, and that worked its way into orthopedic surgery, which is really taking humans apart and putting them back together. I'm Deepak Reddy. I'm a board-certified, fellowship-trained orthopedic spine surgeon here at South Bend Orthopedics. I've been here for 7 years, and I specialize in adult degenerative spinal conditions. I handle the surgical options for patients. That's things where we go in and we're changing, modifying, or removing the anatomy to make their lives better, to get rid of their symptoms. The thing I love most about spinal surgery is that you can have two patients with the same pathology, similar looking MRIs, similar looking symptoms. And you get in there and it's always a little bit different. Everybody kind of needs a tailor-made approach, and it's not the same thing for each patient every time. As a lead up to spinal surgery, oftentimes our patients will see our non-operative team. We have multiple doctors and PAs that help with treating patients and getting them worked up and really trying things before we get to the surgical options. I am very, very detail oriented. If anybody were to come and see my garage at home, it looks like an operating room. Every tool has its place. Everything is in the right place. If my wife borrows a screwdriver when I'm not home, I can open the garage and know within 10 seconds that something's missing. And I take that approach to spinal surgery as well, right? I don't leave the OR unless I'm happy with the construct. I make sure that when I go in to achieve something, I achieve my goal by the end of it, regardless of how frustrating the case is, how difficult the case is, how many curveballs get thrown my way by the anatomy. I really try to do the best I can to make sure that that is a X-ray that I would be proud to show any other spinal surgeon when I leave the operating room. And I really love what I do, and my days in the operating room are fantastic and really just kind of fly by, and it's a fantastic career.